Helping people break the cycle of addiction is personal for Lynnwood Police Chief Jim Nelson.
I think we're all kind of a product of where we come from. When I was about 2 years old, my mom quit drinking. She was an alcoholic, and so she became a chemical dependency counselor. I have older brothers and sisters who lived through the more difficult times when my mom was on welfare and trying to raise kids while managing an addiction. My memories, of course, are a different person, a person who was dedicated, believed in people, and was incredibly resilient and hardworking. And I think that's kind of a parallel for me in police work, in particular in the jail. I spent 4 years working as a jail commander here at the Lynnwood City Jail. It houses misdemeanor inmates, so those are lower level crimes for the city of Lynnwood.
But housing inmates is expensive for taxpayers.
We had people come in and out, but I saw the same faces coming in and out. We weren't able to give them opportunities to get out of the criminal justice system. And that's really, at the end of the day, what our goal is. In our current facility, with our current structure, those just aren't possible.
A physician assistant with Community Health Center of Snohomish County works out of an exam room in the current Lynnwood City Jail that used to be a utility closet. The existing jail has no space for mental health and addiction services, proven to help reduce the likelihood inmates will return after their time is served. Dr. Tom Tosher is the Chief Medical Officer of Community Health Center.
We make do, we manage, but it's certainly not designed from the beginning to serve that role.
So CHC has been working with LPD to design a jail that will connect inmates with care they can continue to receive upon their release. In many cases, that's MAT, or medically assisted treatment.
Medication-assisted treatment is providing medication to treat people with opioid use disorder. It can be another opioid such as methadone or buprenorphine, or alternatively it can be naltrexone, which is typically given as an injection once a month. The old way of thinking was that, well, people should just be abstinent and go to 12-step programs and suck it up. But research has shown that abstinence-only programs don't really help people stay clean that well, and the rate of death and overdose is pretty high. Whereas if you have people on treatment such as methadone or buprenorphine, the rate of death and overdose and other complications goes way down, and they stay in treatment longer. So it has been shown to be effective, and it really isn't substituting one drug for the other. We treat diabetes with insulin. Insulin doesn't cure diabetes. People have to be on the insulin for life. And in that case, we're not curing them, but we are giving them treatment to help them function and live healthier lives.
In 2019, our partners in the medical field spoke to Lynnwood City Council in support of the new Community Justice Center.
The majority of my clinical career was spent working in a federal prison, a federal halfway house, and in community corrections, as well as being a contractor for the United States Justice Department, the U.S. Marshals, the United States Probation Office, and the Bureau of Prisons. Most of my work was spent providing substance use and mental health assessments and counseling to inmates of federal, state, and municipal jails and prisons. Prior to coming to Verdant, I spent 6 years with Snohomish County focused on doing analysis and policy related to those with medical and behavioral health issues who utilize our county's crisis response systems, including the jail and law enforcement resources. I am sharing this with you only to frame the context of my comments this evening. The nexus between health and criminal justice systems is well documented in the professional literature of each one of these fields. Over 80% of offenders in municipal jails have substance use issues. A special report by the Bureau of Justice states that more than 1/3 of all jail inmates, this is municipal jail inmates, have a current medical condition. However, for those over the age of 45, that number increases to 61%. About half of all municipal local jail inmates meet formal diagnostic criteria for substance use and mental health together. Many of these jailed individuals have challenges with employment, homelessness, poverty, and personal and family problems. These compounding issues often make seeking health care upon release a very, very low priority. In my experience, these offenders with chronic health and behavioral health conditions who receive the care they need while they are in jail, with a continuity of that care into the community after they are released, are more likely to become employed, to become housed, and less likely to come back to your jail. This is especially true for those who have addiction and mental health issues. There is a current state policy in place, this is Substitute Senate Bill 6430, that suspends a person's Medicaid benefits once he or she enters the jail. For many of your inmates, Medicaid is their primary insurance carrier. What this means for you as council members is that every time one of your previously enrolled Medicaid inmates become ill, Lynnwood and the taxpayers pick up the bill. Every single time EMS aid car has to come to your jail, Lynnwood and its taxpayers pick up the bill. And every single time an inmate is transported to a local emergency department who was formerly a Medicaid enrolled inmate, Lynnwood and the taxpayers pay for that bill. I am extremely excited about this project for many reasons. Justice-involved individuals will get the care they need, a huge gap in your community will be met, it is fiscally responsible, and it does allow the city of Lynnwood to serve as a regional model.
We share the same clients, and it just makes sense that we would be able to provide the medical care needed. It just makes sense due to our proximity to have us there.
CHC is right next door to the new building site.
I do Suboxone treatment. We call it medication assistant treatment, and it has helped so many people just transform their lives. And if we can get in before they leave and get lost, it would be great to have those wraparound services, not just medical, but social work, behavioral health, outreach, to get them back on their feet and be productive members of society.
Thank you to our community partners for your continued support of this important project.